Hello, guys. My name is Hector Pena, and I'm going to talk to you guys about the impulse control disorder, trichotillomania. And this is the class Issues in Impulse Control. So, what is trichotillomania? It is also called the hair pulling disorder. It is also usually the consistent and irresistible urge to pull out hair from somebody's from the individual's own scalp, eyebrows, or even any other areas of their body that may contain hair. Are there any co-occurring issues? Yes, there are. Individuals who have this disorder may have co-occurring issues such as depression, obsessive compulsive disorder, which is also called OCD, or even anxiety. And what are some symptoms? So, some symptoms may be a sense of pleasure or relief after the hair is being pulled out. Some people may even start to bite, chew, or even eat the pulled out hair that is coming out of the areas of their body. They may also rub it across their lips or their face, and there is an increasing sense of tension, right before they are about to pull out their hair. They even also have an increasing sense of tension when they're trying to resist the pulling. They are usually trying to stop the pulling out of their hair and trying to do it less often, but usually there is no success. They are always experiencing a great deal of distress or problems, whether it be at work, school, their house, or any type of related situations that have to do with society and the community. What are some other symptoms that we're able to see if people may have this disorder? So, individuals can be so focused on pulling out their hair that it becomes like an automatic response. For example, you may be pulling out your hair without even realizing that you're doing it. So, this might happen, for example, when you're bored reading or watching TV. Sometimes they are also doing it when it relating it to emotions. For example, it includes positive or negative feelings. For example, when it comes to negative feelings, people that have trichotillomania may pull out their hair, and it is used as a way of dealing with negative or uncomfortable feelings. For example, those feelings may be stress, tension, boredom, loneliness. They usually are using it as a way to be able to deal with those emotions. But it also may include positive feelings. For example, you may find someone pulling out their hair and it feels satisfying, or if it even provides some type of relief to them. As a result, you may continue to even pull out your hair to keep those positive feelings. So if someone is feeling this recurrent emotion in their body, they might even use it as a reinforcer to themselves because it turns into a sensory stimulation. So usually when it comes to trichotillomania, it also even includes picking your skin, biting your nails, or chewing your lips. Sometimes they even will pull out hairs from pets, dolls, or even materials such as clothes, blankets, and seeing that may be a sign that you could have trichotillomania. When pulling out hair, it is usually done in private. It is not done in public, and such episodes can last in such a ranging time, for example, from a few seconds to even hours. And so, some people will usually, people that suffer from this disorder, will always try to hide this condition from others. What are some risk factors? Some risk factors may be when it comes to the family history. So, genetics actually play a role in the development of trichotillomania. You actually may be more likely to have the condition if you have a close relative that has this disorder. When it comes to age, so some people, usually this disorder will develop before or during the time of the early teens. So usually will often happen between the ages of 10 and 13, and it's often even said to be a lifelong problem. When it comes to stress, that's also a risk factor because usually severe stressful situations will trigger someone that will have trichotillomania. And I've heard of such situations where people have been, they were sexually abused or something like that, and the trichotillomania will actually develop in their lives due to the fact of such situations that happened in the past. So they will it will start to be their coping mechanism. When it comes to the environment, if they're if they're in such an environment where they're bored or where they're isolated, and the privacy often will increase the likelihood of hair pulling. So if there's not too many people around, usually they feel like there is a sense of freedom where they're able to do that by themselves. When it comes to health conditions, some people may even have hair or skin conditions that feel uncomfortable. So this will focus their attention towards pulling hair or even picking at their scalp. So the agency that I am not working for but am choosing to work for in the case of this PowerPoint is TrickStop. So this agency is the world's leading platform for trichotillomania treatment. And what is the mission? What is our mission? We are the go-to online community for all the people that are suffering from this disorder of compulsive hair pulling. At Trickstop, what is it that we believe? We believe that everyone should have the access to such tools that they need to be able to find all the treatment that they need in their lives to develop such coping skills that will help them live their best life. The team that we have in this agency has such a variety of professionals. It includes clinical social workers, editors, advisors, family therapists, psychologists, professional counselors. We have all types of professionals that are able to help people in such areas when it comes to the disorder that they have. And the reason I chose this issue is because it is a disorder that is actually leading to life-threatening medical problems. So it needs to be talked about more, and people need the help. What are some local resources? I was able to research and I found Groundwork Counseling. Groundwork Counseling is a counseling and therapy practice that is located in Florida. It is located in Maitland, Florida, and it is owned and operated by a mother and daughter team who along their side have a dedicated team that are highly skilled mental health therapists. They all have such a passion for helping families, couples, individuals, and even, of course, children. This counseling therapy includes cognitive behavioral therapy, which is also CBT, and they also have exposure and response prevention. They are considered the gold standard of care for anxiety, OCD, and related disorders. And the second local resource that I was able to find is ZenCare. This website is a website that offers therapists who specialize in hair pulling. They have all types of therapists that work all around Florida, and it gives you the chance to be able to be one click away to be able to get in contact with them, giving you the best options, the best chance to be able to cope, to be able to help find some type of treatment. Sorry, to be able to help find some type of treatment that will help you with this disorder. So I want to thank you guys so much for coming in and watching this video. I truly do wish you guys the complete best in all of your careers. It's been a joy being able to to see the perspectives of so many people. And I was blessed to be able to have the opportunity to research trichotillomania for the fact of it's such a disorder that is truly interesting, and to be able to see the behind the scenes of why so many people suffer from it. It can be so many different reasons, like I said, from one of my last slides, like the risk factors. It's so interesting that so many people can develop it from so many different areas. It is not coming down from one area. And that's why I was able to research that the cause is truly not clear, because like many complex disorders, trichotillomania will result from a combination of genetic and even learned factors. So there's so many areas. It's such you have to go more in depth with the specific disorder in people's lives to truly see, to truly get to the core of what it is, of how it was able to develop in their lives. So again, I want to thank you guys for being able to come and listen to my video about trichotillomania. I hope you guys have a great rest of the semester. God bless you guys all. Thank you.